First of all, I have to tell you that suicide prediction is a very uncertain science. We haven't yet arrived at a clear understanding of predictors at the level of individuals. We do know, for example, at the aggregate level, what are some of the factors that are associated with suicide. But at the individual level, it's extremely hard to predict. And therefore, a general rule of thumb is that if you see anyone who is looking miserable, there's a change of behavior, who has become more withdrawn, who is no longer able to engage with you in the way that you remember them to engage with, ask them directly, how are you feeling?
These bad dance make it hurt.
Right now, more than ever, we're talking about mental health. We're hoping that these hard conversations help break some of the stigma around the topic, makes care more accessible, as well as reminds anyone who's suffering that they can feel better and they do deserve to feel better. Today, I'm so excited to have Dr. Vikram Patel, who's a professor at the Harvard School of Public Health and at the Harvard Medical School. He's also the co-founder of a nonprofit organization named Sangath. I've personally had the privilege of taking one of his classes, and I can safely say that each one of his teachings have had a profound impact on me. I'm pretty sure that you're going to walk away with some valuable insights from this conversation today. Dr. Patel, thank you so much for being here today. I was so scared while sending out the emails, saying, will he reply? And I was just over the moon when you did. So I really appreciate you being here.
Well, Kripa, first of all, I want to support all young people like you who are engaging in conversations about mental health. And also, as I mentioned to you in my email, I can never say no to a former student.
Thank you so much. Dr. Patel, there's so much talk about mental health and physical health. Do you think they're two separate entities? Or do you think one affects the other, or that one is more important than the other?
In a very narrow sense, they are separate entities. I mean, mental health is the result of various experiences that are ultimately an interaction between your environment and your brain. And physical health is a much more physical experience of different parts of your body, which of course can also affect your brain. But I think in practical terms, mental health and physical health are two sides of the same coin. They are both fundamental aspects of who we are as human beings. And they, of course, profoundly affect one another. We know very well that when our mental health is affected in an adverse way, it affects our physical health. We feel, for example, all kinds of physical sensations when we're anxious. But similarly, when our physical health has been impacted, for example, when we have heart disease or diabetes, it affects our mental health. So really, the maxim, there is no health without mental health, reflects this perfectly.
Thank you so much for that. I think that's so valuable, especially in today's day and age where we're living in an unprecedented time, a once in 100-year pandemic that's threatening economic welfare, healthcare systems, and governments alike. I know during this time I've thought on multiple occasions, will this end? What if it doesn't end? How do you see this prolonged state of crisis affecting mental health?
Well, I think the key word that you've just said is prolonged. And another key word add to that is uncertainty. Stress is a very broad term, and let's be quite honest, stress can be very positive. In fact, stress is part of the human condition. We often react in an evolutionary way to stressful circumstances, and these are often very proactive, they're very productive, actually. The problem is when these stressful circumstances persist for a long time, and if they're accompanied by a chronic uncertainty, not knowing, for example, whether or not our future will look anything like what we had hoped it would look like. And it is this uncertainty, when it persists over an extended period of time, that is really particularly damaging to our mental health. People who work in the area of early child development often use the term toxic stress. And what they often mean is stress that is persistent, but is also overwhelming, so that our natural inborn mechanisms of dealing with those stress effectively get overwhelmed.
Absolutely. Speaking of childhood development, how do you think this kind of grief is affecting different members of the family, especially with regard to economic well-being? Because so many people are afraid that they may lose their job or they've already lost it.
Yeah, certainly. I think you've hit on a very, very important subject when it concerns the relationship between the pandemic and mental health, and that is the economic consequences of the pandemic. I think there are two different kinds of ways I look at the pandemic and mental health. The first is the pandemic itself, the fear that it's engendered in the population about contracting this disease, potentially dying from it, the fear about, being quarantined, and a whole range of issues that are very specific to the infection itself. But I think the issues that are, and those are often quite chronic as well now, because we're in this prolonged stage of uncertainty about the pandemic already, more than 6 months, and possibly lasting for many more months ahead. But there's a second stage which has already begun to evolve, which is the economic consequences of the pandemic. And that, of course, is both a question of uncertainty. Will my job still be around next year? But for many people, it's a permanent state of losing one's employment, or an acute state of losing one's income, because so many people, for example, in India, are day wage laborers. For them, the pandemic has meant acute impoverishment. Now, obviously, when that happens, we all know that this creates profound levels of stress in a person. This is the kind of stress that I consider as toxic, where you not only have a complete cessation of your immediate income, but also complete uncertainty about when you'll start earning again. That affects your mental health as a person. And then, of course, that creates changes in your behavior that can affect other people in your family. And that is how children can also get affected, by seeing their parents who are very disturbed, very distressed. There is an atmosphere in the home that can be often in itself very toxic for the welfare of children. So really, I see this effect not only about individuals, but also the broader family ecosystem in which individuals live, particularly vulnerable people in that family, such as children and adolescents, who are not directly affected by the economic recession, but are indirectly affected by seeing their families being impoverished.
Absolutely. I think that's so important because I've personally always believed that one aspect of your health can affect others. And it's interesting how your environment also affects your mental and physical well being. I think a huge takeaway I had from your class was that even developed countries are developing to a certain extent when it comes to mental health specifically. But what do you think are some unique challenges India faces when it comes to mental health?
I think India's challenges are very similar to many other low and middle income countries. First of all, even before the pandemic, our mental health care system didn't reach more than 5% of our population. But even that very minimal mental health care was not always evidence based. There's a great focus on very narrow biomedical models of mental illness when we talk about mental health care. There's a focus on what I call the 3Ds: doctors, diagnoses, and drugs. And while this is quite relevant for a subgroup of people with very serious mental illness, it doesn't really embrace the diverse nature of mental health experiences. Another very important feature of India's society, which I think makes it extremely vulnerable to mental health problems, is the very high levels of inequality, which are only being further worsened by the pandemic. And of course, combined with that, very high levels of absolute poverty. And the third important area is, of course, that we have the world's largest number of young people. And we know that mental health problems emerge during adolescence and young adulthood. And therefore, in absolute numbers, we have the largest cohort of vulnerable people, at risk people, simply because of their age. And so, if you look at these as examples of unique vulnerabilities that the population in India faces, I think we need to be taking very urgent and immediate action to preempt what could be another pandemic headed our way, which is a pandemic of mental health problems and suicide.
Absolutely. Dr. Patel, you spoke about how issues of access and affordability persist in this population. I feel that, again, this is my opinion, that mental health to some extent is a luxury for many because often we see people who don't know where their next meal is coming from. So maybe they don't have a chance to go in and think, am I depressed? Am I feeling anxious? Is there something up with my mental health? We evidently have a shortage of medical professionals, especially within mental health in India. But till this treatment gap is bridged, what are some other ways that a general person can access care?
Yeah, and I think this is a really important question. Are there a hierarchy of needs for humanity? You allude to that. Is it the case that survival is more important than the quality of your life. And I think, philosophers and ethicists will argue about that. I can tell you my opinion. Clearly, survival is more important. If you don't survive, the question of quality of life becomes redundant. So certainly, if it's a question of life and death and limited resources, I do see that it is totally legitimate to put your scarce resources in saving lives. But I think in India, we've reached that point where saving lives is an agenda which is still, of course, very relevant. It hasn't gone away. But it is certainly, we've done very well in reducing premature and unnecessary avoidable mortality. For example, infant and maternal mortality, both of those have been reduced quite dramatically. We haven't yet reached the kind of targets we want to get to, but certainly we've done very well in the last 3 or 4 decades. And so the question of healthy years lived, the quality of the life that you live, has become more and more relevant. And therefore, in that context, mental health care becomes extremely relevant. It's also important to remember that mental health care doesn't only affect your mental health. As we discussed earlier, it also affects your physical health. And therefore, premature mortality could be reduced by improving mental health care. Also, improved mental health care makes you more capable to become more productive or deal with the problems that you need to address. So seeing mental health care not only through the narrow prism of mental health, but also the impact of good mental health on physical health and on social well-being actually expands your horizons into thinking about why mental health care is an important investment, even for the very poor. Now, you asked me another question about mental health professionals being scarce in India, and indeed they're very scarce all over the world. I think one of the most exciting innovations that has come from India and many other low-resource settings has been the demonstration that mental health care can be effectively delivered by non-specialist providers such as community health workers, nurses, midwives, and even peers, provided they're given adequate training and supervision. And to me, this completely widens our conversations about resources, because up until now, when we talked about resources for mental health care, we only focused on mental health specialists. Now, we can say anyone in the population, any healthcare provider with adequate training and supervision can deliver mental health care. So the conversation now shifts to asking the question, how do we provide adequate training and supervision?
I think that's so important to show that there's so many other professionals also getting involved in this so that we can provide more affordable and more accessible care to everyone. But you mentioned survival, and that's very interesting because while suicides have always been a subject of controversy when it comes to mental health, the pandemic and the passing of a very beloved figure within India has brought about a whole new dimension over here. The trauma triggered by isolation or the losses suffered during this phase have driven some people to die by suicide. What are some signs that one can watch out for and ensure that we're there for one another to support each other and nurture each other?
Yeah, I think, first of all, I have to tell you that suicide prediction is a very uncertain science. We haven't yet arrived at, a clear understanding of predictors at the level of individuals. We do know, for example, at the aggregate level, what are some of the factors that are associated with suicide. But at the individual level, it's extremely hard to predict. And therefore, a general rule of thumb is that if you see anyone who is looking miserable, there's a change of behavior, who has become more withdrawn, who is no longer able to engage with you in the way that you remember them to engage with, ask them directly, how are you feeling? How are things? Are you doing okay? It's okay not to be okay. And then if the person begins to open up and you realize that the person is actually going through a difficult patch, feel free to ask them, hey, listen, have you been feeling like things aren't worth, living for anymore? Have you been feeling even like you want to end your life? There is no danger in asking people, as long as, of course, you're using it, you're asking these questions following some amount of a conversation to find out more about the person's mental health. Essentially, asking people to talk about their mental health and their ideas of self-harm are probably the most important ways, not only to identify who's at risk, but also, in fact, to help reduce that risk.
Yeah. Dr. Patel, mental health has always been highly stigmatized, despite recent progress. I think we've come a long way from thinking that it's an aberration or the work of a devil. However, what can we do as a community, as individuals, to continue breaking this stigma? And how can we go about having this hard conversation with our loved ones? I remember just the other day I was teaching a few students and they said, okay, we don't feel too good, but our parents aren't supportive. How do we go up and tell them that I may have a mental health issue and I may need help?
So change, I think, is going to be driven by the youth of our country, as many, many major social issues are going to be transformed by young people. Young people are the ones who will always be change agents everywhere, whether it's to do with climate change or whether it's to do with mental health. And I think it's important for young people to start that movement by first and foremost openly talking about mental health without shame, without fear, in the same way we talk about our physical health. Treating mental health as a very cherished and valued asset to each and every one of us. Being able to talk about one's own difficulties with mental health is the most effective anti-stigma strategy I can think about. Self-disclosure, sharing stories about struggles and recovery. And one example I would give is Sangath's It's Okay to Talk initiative, which is exactly intended to achieve that goal, is to get young people engaged in conversations about mental health in a way that almost completely normalizes those conversations. Remember, we're not talking about mental illness here. We're talking about mental health. But in talking about mental health, we also effectively destigmatize mental illness.
I think what you mentioned was so important, that mental health isn't just the absence of illness, but also the presence of feeling better, feeling happy in your body, and everything that follows through with it. Dr. Patel, right now, especially, we're talking about social distancing. What we really mean is physical distancing. We're a species that's bound to connect. We enjoy socializing with others. Human interaction itself can be so therapeutic. What do you think are the short term and long term effects of not being able to interact the way we do with other people?
Well, to be honest, we don't actually have any precedent about long-term difficulties with interaction other than perhaps in prisoners who've been placed in isolation, which is a very extreme and a very different kind of experience. I will say that actually the world is beginning to already return to normal. I think the ideas of physical distancing have become more integrated in our daily lives. They're not as extreme as they were during the lockdown phase. So, for example, wearing a mask, respecting a minimum amount of distance with other people, avoiding crowded situations. To be quite honest, I think these are much easier to adapt to than what we had in the more extreme lockdown phases. And I believe that when any stressor is short term, as we discussed earlier, people adapt to it. People, especially when they see the sense as to why we're doing this, and also that there's an end to this. So, for example, if I told you, for the next month, I'd like you to do this particular kind of behavior that's going to curtail your personal freedom, but because it protects you and your elderly relatives from a potentially very dangerous disease, and at the end of the month, once we are on top of that disease, we're going to have a much more relaxed recovery back to normal. I think you wouldn't be particularly perturbed by that. The problem is uncertainty and rapidly changing realities that actually set you back from what you had expected to do. And that is unfortunately what we're seeing in some countries like the US and India, where there is no real certainty anymore about exactly how the pandemic is unfolding, who's in charge of the pandemic, and ultimately a lot of responsibility has been delegated to the ordinary citizen, which I think is extremely challenging because this is a public health emergency. And what we really need is strong local leadership to inspire, to motivate, to inform, and to support the population to comply with these essential public health measures.
Dr. Patel, I remember one of our first sessions in class, and something that I read from your paper really stuck with me till date, which was mental health issues exist along a continuum. It's not binary as to whether you just have a disease or you don't. As a parting message for anyone listening, if you had some advice for them to take care of their mental health during this troubled period, what would that be?
I would say treat mental health as the single most important asset you have. Think about mental health not only as an absence of mental illness, but actually that it's a dimension with well-being and a positive state of mental health at one end of the dimension and being seriously impaired by mental health problems at the other end of the dimension. And imagine where you are on that dimension every day. And wherever you are on that dimension, do things that can help you move yourself to the healthier end of that dimension. If you're already there, that's wonderful. Keep doing the things you've been doing to stay there. If you're beginning to get into an area of distress, then the first thing to do is to recognize that distress, acknowledge it in the same kind of way that you might acknowledge an unusual pain in your chest. And In response to that, do something about it. And the most important thing that you can do that costs nothing at all is to reach out to someone you are close to, that you trust, and tell them, hey, listen, I'm really feeling pretty grotty inside today, and I need to talk to someone. Just these two acts, acknowledgement, being aware of, acknowledgement, and reacting by talking to someone will probably help the vast majority of people who are having difficulties with their mental health. And finally, for those who are having more persistent, sustained, and impairing experiences to do with poor mental health, seek professional help.
Absolutely. Dr. Patel, thank you so much for being here. I know I've learned so much from this conversation, and I'm pretty sure everyone listening will too. I really, really appreciate you being here, and I'm really grateful for it. So thank you so much.
Thank you, Kripa, and all the very best to you and your colleagues.
Thank you, Dr. Patel.